Good morning. Thank you for joining me. This is Sunday the 29th of March and my name is Siobhan Graham. I work as a GP and this is a blog. I'm going to do this in 3 sections. So the first section is going to be about the COVID-19 disease from this new coronavirus that we're seeing. Then I'll probably start another one straight after that, and that's going to be about the symptoms, what to do if you have the symptoms and how you know if it's severe and if you need to speak to your doctor. And things that you can do at home as well, obviously, to manage this infection yourself. And then finally, what you can do to keep healthy throughout this time of social isolation and social distancing, and what you can do also to maybe reduce your risk of getting this infection. Okay, so I'm going to just start with the virus itself. Why is it so infectious, and what is the social distancing all about, and why do we need to wash our hands so much? So this virus lives outside the body for anywhere up to maybe 7 or 8 days, depending on the surface that it's on. So it's not just those 3 days that we've heard about on our clothes. There have been studies done already showing that it can live, for example, on plastic for up to 5 or 6 days. So it's highly infectious, that's the thing. So social distancing is about not spreading this to other people, because a lot of us will have absolutely no symptoms whatsoever. So we're not going to have the cough, we're not going to have the fever, we're going to feel great, we may even just have a few sniffles. So we are the people that have the control and have the responsibility to not pass it on to other people that may be vulnerable. So anybody that's older, anybody that has lung disease, diabetes, high blood pressure, heart disease, to name a few, anybody that's on steroids or any medication that reduces their immune system. So the virus itself, if you cough or sneeze, it can hang about in the air just in front of you up to 1 metre. And that's why if you cough or sneeze, into your elbow like that. Okay, not into your hand because it's still going to come out to the sides. If you have a tissue, great, put it over your mouth and then bin it straight away. So no putting tissues back in your pockets. Get rid of those old habits. Washing your hands, cleaning your nails. If you have long nails, if your nails need cut, this is the time to cut them. Get rid of those long nails, scrub in under the nails, wash your hands every time you prepare food for anybody. Your responsibility not to pass this on to them if you have picked it up somewhere along the way. You may not have symptoms, as I said. Wash your hands before you eat, prepare food. If you've been out of the house and you come into the house, wash your hands. If you go to the toilet, wash your hands. You may be excreting this. That means passing out of your body when you go to the toilet. You're then obviously using your hands to, do your business, and you've got to wash your hands again so that you don't take it with you. Water should be warm. Make sure you've got warm water and soap. The coronavirus is a little protein and it's surrounded by fat molecules. I just read this the other day. Somebody sent me this talk from a professor in infectious diseases at Harvard University, and I didn't read the whole thing, but I read that part in particular because I found that quite interesting, and it makes it very clear why you need warm water, why you need soap to wash your hands, okay, and why it's so effective. So it breaks away those little fat molecules around the outside of this protein, which is the virus, and then it just decays, it dies away. And you wash it away down the sink, okay, and it's dead. It doesn't have the protection of those fat molecules on the outside. So washing your hands, don't touch your face. The reason for that is if you have it on your hands, if you've been out and about, maybe chatting to people, you've picked it up off another surface, it can get in through the eyes, the nose and the mouth. And that's the reason not to touch your face. Wash your face at night with some water, and make sure and have a shower every day. Wash your clothes if you're out working, if you're a key worker or a carer or somebody that is going to still be having to mix socially within their workplace, then come home, change your clothes. There was some advice initially for medical staff to bag their clothes for 3 days and then wash it. So the virus is apparently dead after 3 days, but there are lots of studies now out there showing that it can live a bit longer. So maybe in clothes it lives for 3 days, but in other surfaces it can live longer. So for washing your clothes, I went off on a tangent. Wash them in a hot wash, 60 degrees. Dry them in the tumble dryer. If you don't have a tumble dryer, dry them normally, but then iron them. And so in a lot of hot countries, excuse me, where they dry clothes outside, you can get these little eggs being laid from different insects, which can cause disease. And so they always recommend ironing your clothes in such countries to avoid those kind of unusual tropical diseases. So this applies for us now. If you're out there working with anybody that could have the virus or has the virus, then come home, wash your clothes, hot wash, tumble dry or iron. Then I think that's everything for the virus. Yes, social distancing is all about our responsibility not to pass it on to other people. So that's all I have to say on that. I hope that's been useful. Just hit 5 minutes, so that's good. Thanks for listening. My name is Dr. Siobhan Graham. I'm a GP, and I'm currently offering it's private telephone and video consultations for Vitalis Health online. So if you can't see your GP or you can't get talking to your GP about something that may not be related to the COVID-19 disease, then you can book online for a time that suits you, see me, and if you need a prescription, for example, that will be emailed to a Medicare pharmacy near you, and you can pick up your medication. And you have to pay for your medication when you're there. It's a private prescription. So I'm going to keep going with these blogs. I hope you've enjoyed this, and if you have any comments or there's anything you'd like me to cover, then please make a wee note at the bottom. Okay, thank you. Bye.